Hi, my name is Stuart Woolley. I'm the paramedic practice leader for the community paramedic, palliative care and low acuity pathways within BCEHS. And welcome to the April 2022 clinical update video. We have lots of clinical updates this month related to ASTaR pathways and secondary triage. Beginning Monday, April the 11th, the Kamloops UPCC will begin accepting referral from BCH paramedics who meet the generic referral criteria and present with minor wounds, minor allergy, minor burns, and non-traumatic back pain. Additionally, the Kamloops UPCC are now receiving referrals from secondary triage paramedics in our Vancouver Dispatch Centre. For paramedics working in the Kamloops area, I'd love for you to keep this option in mind when attending patients in the community. We know that UPCCs are a vital option for patient care, assisting in getting patients connected to the right care the first time. This approach is also going to help us reduce emergency department overcrowding and improve flow for critical patients that we'll see in the community that do need an emergency department. We also have a new ASTaR pathway in place addressing gastroenteritis. We know that acute gastroenteritis is a common disease in children and adults, and the viral etiologies of gastroenteritis are most common, presenting in approximately 70% of cases. Whilst acute gastroenteritis carries a low mortality risk in Canada, there are several high-risk populations who require in-hospital management. However, for the most cases of acute gastroenteritis, oral rehydration and rest are the primary therapies when helping the recovery, which usually occurs within a couple of days to a week. In recognition of this, an ASTaR, Assess, See, Treat and Refer clinical pathway for patients went live on April the 4th. Using this pathway, paramedics can provide supportive care on scene without conveyance to the hospital following consultation with clinical. Patients will receive a follow-up within 48 hours to monitor the development of any red flag symptoms. An education package has been developed to support this clinical pathway, and it will be available on Learning Hub very soon. For colleagues in the Vancouver coastal area, we have a frailty ASTaR clinical pathway, which is live. We know frailty is a clinical syndrome with variable definitions, but generally consists of a constellation of older patients with reduced physiological capability to tolerate minor stresses. There's an increased vulnerability to adverse health outcomes and impairment in the multi-physiological systems. And approximately 10% of community dwelling patients over the age of 65 meet the clinical definition of frailty. To help mitigate the adverse effects of frailty, Vancouver Coastal Health developed the Home Visit to Vancouver Elders Home VIV service in 2008. This program is comprised of physicians and allied health professionals to provide 24/7 primary care to frail homebound elders in Vancouver. This group aims to reduce any unnecessary ED visits and hospital admissions for patients in the community and support life and death at home. Although most patients enrolled in the Home VIV system will have contacted their program before phoning 911, we do know that a subset of patients will contact paramedics for low acuity illness and injury prior to discussing the case with their on-call practitioner. To help mitigate the unnecessary conveyance to the ED and subsequent harmful admissions for these patients, paramedics working in Vancouver coastal region may consult the Home VIV clinicians prior to conveyance if they find their patient is enrolled in the program and presents with non-critical illness or injury. Currently, we have approximately 600 to 700 patients per month who are eligible for an ASTaR clinical pathway but are not enrolled in them. In March, we saw 15 patients enrolled in an ASTaR clinical pathway. And with the addition of 2 new pathways this month, there are now 6 available to us throughout the province. These include palliative care, ILI and COVID-19 management, minor burns, epistaxis, asymptomatic hypertension, and gastroenteritis. And more information can be found on the BCEHS handbook. An update on the Frontier trial. Thank you to all of our paramedics and EPOS physicians who have enrolled patients in this Frontier trial. Your diligence and time is critical to advancing knowledge in acute stroke management, and your efforts are really not going unnoticed. We have 3 sites in Vancouver, New Westminster in Surrey, and Kelowna, and they've collectively enrolled 385 patients as of February 2022. This includes 241 ischemic strokes, 71 hemorrhagic strokes, 27 transient ischemic attacks, and 46 stroke mimics. Out of these, 169 were ultimately treated with TPA and/or endovascular thrombectomy. The median time frame from symptom onset to administration of the study drug, either niretidine or the placebo, is 60 minutes. For our CCP colleagues, the mcgrath video laryngoscopy has been delivered, or is in place of being delivered to CCP bases. Training is provided in the winter 2022 clinical update, and CCPs are authorised to integrate the mcgrath into their clinical practice once the winter 2022 update has been completed. If you have questions regarding any training or deployment of these, please do contact your unit chief or your community, your local paramedic practice educator. We have an update on BCEHS Section 56 exemption. On March 4th, 2022, Health Canada updated the BCEHS Section 56 exemption to allow PCPs, ACPs, CCPs, and ITT paramedics to possess and administer binoforine. Binoforine is a component of Suboxone, which is an opioid agonist therapy used in the treatment of opioid use disorder and acute opioid withdrawal. This is an important step for paramedics in BC, being able to make a more proactive step in supporting people who use substances in British Columbia. BCEHS will now work with the Ministry of Health, Ministry of Mental Health and Addictions, BC Centre for Disease Control, and the BC Centre for Substance Use to have this approved within BC specifically, and subsequently develop education, clinical practice guidelines, and a clinical governance structure for this medication. We have several BCEHS patient experience groups underway as well. Enhancing patient experience of healthcare is a key component of a quadruple aim. The international recognised framework aims to support the design and delivery of effective healthcare systems and closely aligns with BCEHS visions, values, and strategic goals. Essential to the success of this approach is engaging and empowering patients to play an active role in their care and improving outcomes and safety. When patients are actively involved, they can become informed decision makers and help improve the design and delivery of our healthcare systems. When healthcare providers listen and work with patients, their first-hand knowledge, insight, and experience can improve programs, service delivery, and policy. In recognition of this, BCEHS has partnered with the BC Centre for Disease Control, the Patient Voices Network, to create 3 patient experience groups to support patient-centred care within BCEHS. Presently, these are the BCEHS Patient Experience Group, the BCEHS and Patient Voice Network with people with lived and living experience of mental health Patient Experience Group, and the BCEHS BC CDC People with lived and living experience of substance use. Each group will meet monthly to discuss the changes in BCEHS practice, policies and procedures from a patient perspective and represent an important step for our organisation. Details on how BCEHS leaders can engage with these groups will be provided in the coming weeks, so please do keep an eye out for that. We plan to expand patient participation in our hiring committees and other aspects of work across the organisation after we learn from these initial experiences. Thank you for watching the April 2022 practice update. We look forward to our next clinical update practice video, which will be in May. Take care.